If you have erectile dysfunction, ED, or have ever had insufficient blood flow in the penis, you are aware of how this can affect your sexual confidence and relationships. There are techniques to battle this and improve the blood flow to your penis, even though most men may experience low libido and weak erections at some point in their lives. We'll discuss male infertility, erectile dysfunction, and all natural ways to increase blood flow to and from the penis in this video. Erectile dysfunction may be present in your spouse if they have trouble achieving or keeping an erection or ejaculating during sexual activity. Male ejaculation is necessary for conception. Although ED doesn't officially render a guy infertile, it can worry those trying to get pregnant. Around the world, male infertility accounts for 40–50% of all cases of infertility. Even though there are numerous treatment options available for infertility, it can still result in tremendous stress for people who are trying to get pregnant. Reasons for ED. The root reasons for ED are frequently intricate and multifaceted. In general, organic and non-organic causes can be distinguished. Natural causes. While non-organic refers to psychological factors, organic describes specific alterations in the anatomy of the body. Despite evidence showing that about 15–20% of ED cases in males under the age of 40 have an organic origin, the cause of ED was previously believed to be predominantly non-organic. Hypogonadism, or low testosterone levels, is another biological cause of ED. More research is required before making firm conclusions about this. Other factors concern the penis's nerves, blood vessels, and neurological system. This is because nerves regulate blood flow and the emergence and upkeep of an erection. Unnatural causes. Non-organic causes include psychological ones. These include worry, stress, and other strong emotions. One illustration is experiencing performance anxiety and being concerned about performing in bed, which prevents you from getting an erection. Psychogenic factors are more common in younger people than in older people, according to recent research. These factors can lead to nocturnal erections, and they are frequently situation-specific. Diagnosis. You must see a doctor or expert to get an ED diagnosis. To determine the best course of treatment for you, they may grade the severity of your ED. The International Index of Erectile Function, IIEF, 5-7 uses a point system to assess the severity of ED. Blood tests are required to look into potential organic cause risk factors, such as your personal and family history. For instance, one ED test would examine blood glucose, lipids, and other indicators of diabetes. This is due to the connection between ED and diabetes. PDDUS. Using the penile Doppler ultrasonography, PDUS, 8 technique, blood flow to the penis is measured both before and after the application of a vasodilator. A cardiovascular issue would be indicated by an increase in blood flow and may be treated. Test for nocturnal penile tumescence. The nocturnal penile tumescence, NPT, 9 test uses a specialized electronic instrument to look for probable nocturnal erections. Erections are not present, which suggests an organic source. Due to its unreliable and cumbersome methodology, this test is now only occasionally utilized. Test for injection. In general, there aren't many intracavernosal injection tests performed. It might, however, prove helpful occasionally. To try and induce an erection during this test, the doctor injects medication into the patient's penis. Vitamins and AMP, supplements that boost penile blood flow. The use of vitamins and supplements to maintain bodily health has yielded conflicting results, according to studies. What if, however, you wanted to boost the flow of blood to your penis? Before beginning to take any additional vitamins, it's crucial to make sure you're getting the proper amount and to speak with your doctor to rule out any potential drug interactions. Nutrition D. There is a reason why vitamin D is well known. This vitamin aids calcium and magnesium absorption in the body. While some foods contain it, the sun can also be used to create it artificially. By maintaining the integrity of the cells lining your blood vessels, vitamin D can also aid in the promotion of healthy blood flow. Ginseng 12 has been consumed for many years in various Asian nations. It can assist increase vigor and enhance male sexual performance. Traditionally, ginseng is consumed as a powder to add to tea, consumed raw, or taken in capsule form. You may even experiment with cooking with ginseng. Yohim. Yohim is a natural remedy that has been used for centuries by natural healers to treat ED and sexual dysfunction. It comes from the bark of an African tree. Yohim bean, the standardized form, has shown encouraging effects in enhancing sexual function when used in conjunction with other therapies, while further study is still required. L-arginine. L-arginine is a kind of amino acid that can aid in boosting circulation and widening blood vessels. Although it can be found in some foods that are strong in protein, such as nuts and meat, L-arginine is often taken as a supplement. Goat hornweed. As its name suggests, horny goatweed is a well-liked remedy among many alternative health practitioners who think it can aid in blocking an enzyme that limits blood flow to the penis. It has also been used for many years to treat ED organically in China. Herbs that increase blood flow. Many people have looked at alternate and less harmful means of treating ED, even though regular medication can work miracles in treating a variety of health concerns. Recent years have seen a rise in the use of herbal treatments to treat a variety of illnesses. Although you may believe that herbal treatments for erectile dysfunction are effective, there is little data on their safety and efficacy. Herbs shouldn't be used in place of your doctor's recommended course of therapy entirely. Due to the paucity of research, the majority of studies have focused on cerebral blood flow rather than necessarily penile blood flow. Ashwagandha, a well-known herb, was once thought to help treat ED. Studies haven't discovered any advantageous effects in males taking the herbal medication for ED, though. Additional plants that could enhance blood circulation include the herbal medication used in China to enhance cerebral blood flow is zhuantol. The calming effects of lavender aromatherapy 16 can increase circulation. Holy basil, or tulsi, may lower blood pressure. Ginger. Garlic. Please be aware that further research is required before making any firm conclusions about these plants. How to increase blood flow organically. By altering one's lifestyle, one can increase blood flow to the penis organically. This is frequently the quickest and least expensive approach to experiment with various ED treatments. Additionally, changing your living habits won't hurt you, and you can obtain the support you need from loved ones. It might be difficult to develop new habits and break bad ones on your own. Encouragement and patience are required if you or your spouse want to make adjustment to enhance blood flow to the penis. To increase motivation, it could be more advantageous to join a support group. You might think about making the following lifestyle modifications to naturally enhance blood flow to the penis. Everyone, regardless of age or demographic, should engage in regular exercise to maintain a healthy lifestyle. Exercise can boost your heart health and blood circulation in addition to toning your muscles and keeping you healthy. Yes, your body will be getting more blood flow, especially to your penis. Post-workout, one can still experience these impacts. For the therapy of ED, doctors advise regular exercise. Additionally, evidence points to a link between moderate to vigorous physical activity and a lower risk of ED. This can be made simpler by exercising alongside a spouse or family member. They'll provide some companionship, hold you responsible, and increase your drive. Try modest aerobic workouts like cycling, power walking, light running, or swimming if you are extremely overweight or haven't exercised in a while. Stress reduction. According to research, 37% of people with EDS are said to have anxiety issues. Try to discover ways to relax to lessen tension and anxiety in your daily life to boost the blood flow to the penis naturally. Even though it can sound more straightforward said than done, all it requires are some minor lifestyle changes. Massage. While it might seem unusual to naturally boost blood flow to the penis, massages are a terrific method to relax and reduce tension and unsettling thoughts. You might ask a spouse or member of your family to massage you. As an alternative, hiring a licensed massage therapist might be a wise investment. Our brains might get overloaded with stress and anxiety because of all the events that occur in our daily lives. A massage now and again can help calm the mind and relax the muscles because those who have anxiety issues have a higher risk of acquiring ED. Massages can raise muscle warmth and blood flow in addition to relaxing the recipient. Drinking fluids. The most healthy fluid for our bodies is water. Dehydration and ED are associated. According to a study that was published in the Cambridge University Press, dehydrated males have worse moods and worse cognitive abilities, which could cause worry. Since ED and anxiety have been related to one another in multiple studies, you can consider adding more water to your daily routine. A smart approach to ensure that you always remember to hydrate is by carrying a sizable water bottle with you to work, the gym, and when you're doing errands. No more than 3.7 liters of fluid will be enough for a typical adult male living in a moderate climate. Stop smoking. It's important to refrain from smoking and using heavy drugs if you have ED. ED risk is increased by tobacco use. Smoking can harm blood vessels all over your body, and ED may be brought on by a lack of blood flow to the penis. You could wish to suggest to your partner that they give up smoking as well. Second-hand smoke exposure, sometimes referred to as passive smoke exposure, has been linked to an increased chance of developing ED, according to research. Fortunately, quitting smoking today can have numerous advantages. In almost 25% of smokers who gave up, ED status improved after a year, according to studies. Diet. According to some research, adopting a healthier lifestyle and getting enough nutrients can have a favorable impact on your erections and penis. Implementing a healthy diet can aid in weight loss because obesity can also contribute to the emergence of ED. Particularly, a decreased incidence of ED is associated with the Mediterranean diet. This anti-inflammatory diet has been demonstrated to improve symptoms and support weight loss. Do you like this video? Give your valuable response in our comment section below. And don't forget to subscribe to our YouTube channel for more videos like this.